Good afternoon and welcome to this very special Facebook Live we have here on blackdoctor.org. I am Ellis Dean, the Director of Digital Programming and Production here at blackdoctor.org, and we are excited to bring you part two of our three-part series on the liver. And so I know some of you might be scrunching up your face going, the liver? We don't talk about the liver. Only time we talk about the liver is when it's smothered with onions and gravy, but that's not what we're going to be talking about today. We know Thanksgiving's coming up. You might talk about it then, but today we're going to be talking about the liver in a very, very special way. So if you missed it 2 weeks ago, please go back and go to our YouTube page and watch the first part of this series about the liver. We learned some fascinating things about it. I know I did. I don't know if you did. I learned some very fascinating things about the liver. Like you can cut it in half and it will regenerate. I didn't know that. I know that we learned that there's 0 to 4 in terms of fibrosis on the liver, in terms of liver damage. And then 4 is that level, that the word that we do know, cirrhosis, but it's not always caused by alcohol, but there's other things that can cause cirrhosis. And then at that point, that puts you at danger for liver cancer. There's all these, the liver is a filter for the body. Hepatitis is a general term. It just means inflammation of the liver, and those letters are what causes that inflammation. So we learned a great deal about the liver just 2 weeks ago. So please go back and watch that program. So today we're going to continue on with that series. We got another specialist here. We got Dr. Lewis Roberts here, and he is going to take us even further. We're going to be talking about the steps of liver cancer. So this is this is the scary stuff. This is the stuff that pushes you over the top. So when you get to that stage 4, cirrhosis, then now we're talking about the serious stuff. What can lead to liver cancer, and what are some things we can do to prevent it? And if we get to that stage, what are the treatment options available to us? So let me tell you about who we have here. Okay, you think Dr. Gunn last time? This brother is bad. I'm just saying, he's Michael Jackson. We're just going to call him Michael Jackson. He's a bad, bad man. So Dr. Roberts is the Peter and Francis Gorgeson Professor in Gastroenterology, Cancer Research, and consultant at the Gastroenterology and Hepatology at the Mayo Clinic, where he is a co-principal investigator of the Mayo Specialized Program of Research Excellence in, I can't even say that word, hepatobiliary cancers. Okay. He's written over 400 articles, book chapters, letters, co-edited the book Evaluation and Management of Liver Diseases. He is that dude. And so we're going to bring on Dr. Roberts here just shortly, but I'm going to say one quick thing. The American Liver Foundation would like to thank the sponsors for the support of this focus on Black health sciences on liver disease and liver cancer. That is Ascites, Bausch Foundation, Genentech, and Merck. So that's this is a partnership with the American Liver Foundation, so I want to thank them for their partnership. And so I'm going to shut up and bring on our guest, and this is Dr. Lewis Roberts. Good afternoon, Dr. Roberts.
Good afternoon, Alice. How are you doing?
I am doing great. Look, I hope I didn't embarrass you too much with the introduction.
As they always say, that made my mom proud.
Well, I think you've done a really great thing in terms of making your mother proud. So I just applaud you for everything that you've been able to accomplish in your career. And I know this wasn't one of the questions we had, but what made you choose the liver as kind of your specialty study?
It's a great question. It actually started, I grew up in Ghana in West Africa.
Okay.
And went to medical school there. And liver disease is quite common. It's caused by chronic viral hepatitis, one of the types of hepatitis we'll talk about, which is hepatitis B. Okay. And when I was training in medical school, I took care of a couple of really young people who had liver cancer. Okay. And so in the course of my training, the rest of my training, I ended up studying liver diseases and sort of becoming an expert in the study of the biology of the liver. But when my colleagues asked me if I wanted to stay on faculty and what I wanted to do long term, it sort of took me back to those roots in a sense, and remembering people with liver cancer that I'd taken care of. And I decided to focus my career on better understanding, preventing, and developing ways to better diagnose and treat liver cancer.
Well, great. Well, we're happy to have you, and we're happy that the fact that you had to treat young people with liver cancer, but the fact that they've got such a great specialist as part of in their lives. And so, was I right in my lead up? Was I? Could I learned all that stuff just 2 weeks ago. So did I hit it? Did I do a good summary of where we're going?
You're getting to be a good hepatologist, as we say, a liver doctor.
Okay, well, we'll call it a street hepatologist. I can get you. I can get you somewhere. So, a couple of things that we learned in terms of our research with regards to the liver. Liver cancer is more common in men than in women. Liver disease is a progression. We talked about that, and cirrhosis kind of being that final stage, which I didn't realize that I just kind of associated a one-to-one association with cirrhosis and alcoholism, which can be a cause of cirrhosis, but is not the only cause of cirrhosis. So I did learn that. The most current data indicates that liver cancer is among the top 10 causes of death in the United States among all races, ethnicities, and genders. Did not realize that. I mean, I know there's so much focus on heart and cancers that we don't realize that the liver and other organs, and there are treatment options. We're going to talk about that. So we know it's not just alcohol, but what are some things that cause liver cancer?
Yeah, so as we were mentioning at the beginning, chronic viral hepatitis. And so viruses that infect the body, and when they infect the body, they go to the liver, and they prefer to infect the liver cells. Those are the commonest causes globally. And so there are two main viruses. We call them viral hepatitis B and hepatitis C. So those are the ones that cause what we call chronic hepatitis. So many people have heard about acute viral hepatitis, where, if you eat some contaminated food, shellfish, you might get, fatigue and jaundice, and it lasts for a few weeks or a few months, and then your body, mounts an immune response, you clear it. That's acute hepatitis. Your body your immune system figures out how to get rid of it. Okay. In the case of chronic hepatitis, you get the hepatitis B virus often as a young person, and then the body can't get rid of it. And so it keeps infecting and reinfecting your liver. You talked about that regeneration that occurs in the liver. Right. And it basically, because your body can't fully get rid of it, you keep getting this injury and regeneration, and eventually you wear out your ability to clear, to remodel your liver to make it back to normal, and that's when the scar tissue starts to form, and so you get the fibrosis and cirrhosis you were talking about. Okay. So hepatitis B and hepatitis C are the commonest causes, and then the other cause that is increasing is what we call obesity-related fatty liver disease. So we've had this sort of obesity epidemic where the overall size of our population is increasing. And as that happens, people who have obesity, have diabetes, hypertension, or high cholesterol are at higher risk of depositing fat in their liver. And then that fat can cause inflammation and also cause scar tissue to form. I'm not quite. I'm not hearing you. Are you? I wonder if you're having some technical problems, or I'm having technical problems. I can't hear you. It looks like Ellis may have run into some connection problems. Let's just give him a minute or so and see if he logs back in. While we're waiting, perhaps I can go ahead and talk a little bit more about the specific causes of liver disease or other questions that people commonly have about liver disease. So often, we talk about the causes of liver cancer, and it's not uncommon to be asked, what are the symptoms of liver cancer? If I were to develop liver cancer, what kind of symptoms would I have? Would I have pain? And the challenge with liver cancer compared to some of the other cancers that we can have is that it is typically what we call asymptomatic. People develop the cancer and they, for a long period of time, may not have any symptoms of the cancer. And so until the disease reaches the late stages, often people are not aware of it. And the main reason for this is that in the substance of the liver, there are no pain fibers. So the lining of the liver has pain fibers, but within the substance of the liver itself, there are no pain fibers. And so you can have a tumor that develops, grows in the liver to often quite a large size, where the patient has absolutely no idea that that's going on. And so the key thing about liver cancer is that it's important that everyone determine whether they are at risk for liver cancer. And if they find that they are at risk for liver cancer, then it's important that they go into a process of regular screening, which we call surveillance, to allow diagnosis of liver cancer at the earliest possible stage when it is very treatable. I see, Alice, you're back. Can you hear me okay?
Yes, I have. It's like 1 minute we were talking, and the next minute I'm kicked off, and I was completely off the internet. So I apologize to the audience. I apologize to you. I can't control those technical difficulties that happen from time to time. So I'm glad you kept going.
Yes, we talked a little bit about symptoms of liver cancer and the importance, because typically you don't have symptoms with liver cancer until it's late. It's important that we all understand whether we are at risk. And if we are at risk, then we can, enroll in what we call surveillance. So we get regular screening so that if we do develop a liver cancer, it's detected very early at a stage that is very treatable.
So that was a couple of things that we talked about on the previous show. A couple of things that we learned. One, the liver is a very lean organ. So when we start developing, fat starts getting into the liver, that's when you have a problem. And I think Dr. Gunn was saying anything more than 5% fat in the liver is going to start that first stage of fibrosis in terms of scarring the liver. When you start getting that kind of fat in there, and that's a sign. Also, one of those things she also mentioned was that there's not a lot of tests that can be done. Like with high blood pressure, you put your cuff on, you can check your blood pressure. With high cholesterol, do a blood draw, they can test, but there's not a specific test that says is a marker for liver disease. And so that becomes problematic. There might be like some jaundice that happens. There might be some graying of the skin, bloated belly with thinner, arms and legs. And you got this big bloated belly. Those are signs, but there's not specifically a test that could be done. Is that true and accurate?
Yeah, that's correct, and especially because the signs that you described are signs that tend to occur at the end stage of liver disease.
Okay.
And where most people would like to find out if they have liver disease at the early stages, where you can do something about treatment. So that's why it's very important that we think, for example, that all adults, and I think that's the current CDC recommendation, all adults in the country should be screened for hepatitis C, for example, because hepatitis C is the more common of the viral hepatitis. And so that's like a general recommendation. That way, if you're screened and you're positive, in the case of hepatitis C, we have treatment that can cure now about 97-98% of people who have chronic viral hepatitis C. So we have very effective treatment for it. Hepatitis B is getting to be to the level in the adult population also that there's, I think, likely in the next year or two going to be a recommendation that all adults be tested for hepatitis B.
Okay.
Yes. And
so we know about alcohol, and we know about IV, sharing needles can also be kind of a marker for hepatitis. That puts you a risk factor. Are there other risk factors that can that can increase your potential of having liver disease and then potentially liver cancer?
yes, there are, and one of them isn't as obvious, but there appears to people who have viral hepatitis, the likelihood that they will progress to develop cancer tends to run in families. So it looks
Okay.
as though there's a certain inherited tendency that predisposes people to liver cancer. So if you should have a family history of liver cancer, then it's really important to be tested to make sure that you don't have one of the major causes of liver cancer. But in addition, things like smoking have been shown to substantially contribute to risk of cancer. And then there are dietary toxins. One in particular is called aflatoxin. So aflatoxin is a fungal toxin that contaminates grains and nuts. And there's fairly extensive work that goes on in the United States, for example, through agricultural extension services to teach farmers how to harvest and store their grain to prevent them getting high levels of aflatoxin.
Okay.
But in certain parts of the country, food may be brought in from other countries that has higher levels of aflatoxin. So it's important just to be conscious of that. There are toxins as well that can affect risk.
Okay. And I noticed in my opening statement, I talked about liver cancer being more prevalent in men than in women. Is that just because we tend to be more risky in our behaviors, or is there a specific scientific kind of reasoning behind why it's more prevalent in men than in women?
Yeah, it seems as though indeed there might be a small fraction of that increase that is due to men perhaps having, as you said, riskier behaviors.
Mm-hmm.
But the major cause of the difference between men and women actually appears to be biological.
Okay.
In that women appear to have less of a tendency to inflammation in the liver than men do. And there's some suggestion from the studies that have been done that estrogens, which women have more of than men, actually suppress some of the immune responses in the liver and the inflammatory responses in the liver. And so women then tend to have less of a propensity to get the scar tissue formation and the development of cirrhosis in the liver.
Okay. Well, yeah. Well, man, you got to get it together. So I know there's not a pretest, but if there's a family history, I should be looking for signs of potentially having liver disease and potentially liver cancer. If I'm male, with a family history, and then if I'm male with a family history that drinks, smokes, eats foods that have high in carcinogens and things like that. If I'm obese, obesity kind of leads to it. So we're starting to kind of build a blueprint here. The reason I'm trying to give a summary for our audience in terms of like, there's a blueprint that shows, hey, these are some significant signs that point you towards having liver disease and or potentially liver cancer. So
that's right.
We know the liver can regenerate, but over time, as you mentioned earlier, over time that regeneration process slows. So is liver cancer, so if you get to that point where you go past cirrhosis, you develop liver cancer, is liver cancer curable if because now at that point the liver is damaged so much that it becomes cancerous? Is it curable?
Yes, it is curable, and it really The treatment depends on the extent to which a person develops the severity of the liver disease before the cancer develops. So what we see is that for some people, yes, they have some scar tissue in the liver, but it has not developed all the way to the cirrhosis. But they might have enough change has occurred in the genetics of the liver cells that they develop into a cancer. So in that case, you have a cancer that develops, but the function of the liver is still adequate. And so if you find a cancer that has developed like that in good, adequate liver function, you can take the person to surgery and remove that, that small spot of cancer. Sometimes if it's a small enough spot, we'll do what we call an ablation, where we put a probe like a needle into the tumor. And then they have techniques that allow us to heat the tip of that probe. So it's sort of like we cook the tumor and the surrounding area. And that basically destroys the tumor. So if the liver function is good, then we can do treatments like that. If, on the other hand, you have someone who, just like you were describing, the liver disease has progressed to close to the end stage, and then they develop a cancer on top of that, then typically what we will offer, if the disease is caught early, the tumor is caught early, we will offer a liver transplant. Because what the liver transplant offers us is the opportunity to remove the tumor, but also the diseased liver, and then replace it with a new liver.
Okay, so what in our previous program, Dr. Gunn said that it's liver transplants are the threshold for finding a match is lower than, like, for example, like a kidney transplant. You just need to have the same blood type in order to have a transplanted liver, and you don't need an entire liver. If you have a healthy liver, you could basically take half of it, and if it's healthy liver, it can regenerate to a whole liver.
That's right. It's remarkable.
Now I found that to be so fascinating because, when we're thinking about, liver health, and you hear transplant, you immediately start thinking about what you have to go through with the kidney, and everybody's got to get tested, and you got to find a match, and there's a family, there's all that. Then you get on this registry, and so there's all that that goes with it. I can speak on that from personal. And my father's in dialysis, and he's on the list. But until he finds a match, he's just going to continue to be in dialysis with kidney failure. So it's just the liver seems to be a remarkable organ in that, there is that lower threshold, and there is an ability to more survivable. Is that, I guess maybe that's the, liver cancer has a potential, if it's caught early enough, it's more survivable than other types of illnesses.
Absolutely. If we find, and that's really I think one of the key messages here is identify if you are at risk of liver cancer, establish whether or not you have a risk factor, and start being in screening or surveillance for cancer. Because if we find it early, it has really good outcomes. Liver transplant for liver cancer has 5-10 year survivals above 70%. So it gives you a survival that's almost equivalent to just people in your age range, their survival. And the same thing is true if we find it early and the liver function is good, in terms of treatment with surgery or one of these ablation techniques. If we can do that, we actually have outstanding long-term survival. One of the other things, of course, is that for chronic viral hepatitis, we have exceptionally good treatments. We can cure hepatitis C, we can suppress hepatitis B, and we know that when we do that, then we also reduce the risk of progression to development of another liver cancer, for example. And so knowing you're at risk, getting treatment reduces the risk. If people are using alcohol and they recognize that it's a risk for liver cancer, they can stop using alcohol, and we know that over time the liver will actually recover from the damage. And the same thing is true of the obesity-related fatty liver disease.
And for our audience sake, and probably for my own, the alcohol is 2 drinks or less per day for men and 1 drink or less per day for women in terms of that the top end of the healthy range. You probably want to drink less than that, but if you but that seems to be the range that was provided before.
Yeah, so those are the cut points for where we know above that there's a high likelihood of people showing evidence of damage in the liver.
Okay.
As we have studied this more and more, particularly in people who also are more obese, what we see is that then the level that of alcohol needed to cause injury, if you're overweight or you have diabetes as well, then that level drops.
Okay.
So we're actually getting to the point where we are thinking, yes, occasional alcohol use, is okay, but really, in terms of regular alcohol use, we're getting to a point where we're thinking, for many people, there isn't a level of alcohol use that is, in a sense, safe, particularly if they have one of these other risk factors.
Okay. So the risk factors play a significant role in terms of as kind of a confounding agent in terms. So basically, that 2 drinks that I said, or 1 drink if you're a female, is based on everything else being clear.
Exactly. Yeah.
So when you start, adding obesity into it, you add diabetes, hypertension, other factors, then that number comes down significantly. Or if you're a smoker, that number comes down significantly because there's an interactive effect that it has on the body. And we talked about that. What role does stress? Because I know, on other programming we talked about. We took this show called Stress Belly, right? And we talked about that. The visceral fat and the subcutaneous fat, and that subcutaneous fat, correct me at any time I'm wrong here, Doc, but that subcutaneous fat is in part increased by stress levels as well as risky behaviors, engaging in behaviors like drinking. And so that subcutaneous fat can start to wrap itself around our organs, especially in the gut area, and that includes the liver. And so you can get into fatty liver disease as well. Is that accurate?
I believe so. And I think the key is that, stress tends to have effects on just as you're describing it, on other parts of our physiology of our body.
Okay.
And often those effects are negative. And people, and it's not maybe with everyone, but there's definitely people who, stress is the way they respond to stress is tied to their hypertension, for example. We know that hypertension is a risk factor. The way they respond to stress affects how they eat. And that then ends up affecting their body composition and their sort of level of inflammation within their system. So I think the things that we do that reduce stress definitely help our overall health.
Okay. Yeah, you said that bad word, inflammation. We don't like that word, or Black Doctor, because somehow inflammation always ends up to something going wrong. Okay, so here's a tough question, and the reason why I'm saying it's a tough question is because why the question why always has so many different answers and different scenarios that you can attribute to why. So what we know is that liver cancer is increasing in Black people, and particularly in Black men. I guess the better question is, are there any markers that suggest as to, what is the cause of that increase?
Yeah, I think it's important to cast this in the larger context of what's happening with liver cancer in the United States, because liver cancer is increasing in almost all racial and ethnic groups, except actually for Asian Americans. And the reason it's decreasing in Asian Americans is that they used to be the population with the highest rates of liver cancer, because the Asian population that were mostly immigrants from Asia had relatively high levels of chronic hepatitis B virus infection, which is one of the chronic viral hepatitis infections. Right. And so with the work that's been done with vaccinating children, with identifying who's at risk in the Asian population, treating them for their viral hepatitis, we've been able to suppress the rates of viral hepatitis. And so in that population, we are beginning to see decreasing rates of liver cancer.
Okay.
But in many of the other populations in the United States, and this includes the white population as well, we are seeing increases. And so even though the rate sort of per 100 people, for example, is higher in the African American or Black community, because we have higher rates of some of the risk factors, this is also something that's happening in the white community, in the Hispanic community as well. We're seeing these general rises. And so I think it's important to recognize that it's not only in the Black community, but for us Blacks, it's important to recognize that it's happening in our community. And
Right.
it's important to identify what our risk factors are and address them. Part of, I think, what we see in the Black community also relates to potentially specific, perhaps dietary habits that we have, specific tendencies that might be inherited, relating to the development of fibrosis or scar tissue in the liver. But I think the big picture is that having any of these risk factors we've talked about, and we talk about the four major ones, puts people at higher risk. And we've been seeing those things increase across the board in the United States, particularly the increase in basically fatty liver disease that due to obesity, diabetes, hypertension. These are all things that are major causes of illness in the African American and Black community.
So, I'm gonna try to summarize it for the folks. Is that basically, especially it seems like during the pandemic, there has been increases in poor dietary habits in terms, because I've seen studies that show that dietary habits have gone really bad during the pandemic. There has been an increase in alcohol use during the pandemic, and subsequently there has been a decrease in terms of seeking out medical services, because we're not going to our doctor's appointments on a regular basis. We're not getting our labs checked, and we're not even going to the hospitals because of COVID and fear of catching COVID. And so those things in particular have, like what you're talking about, has increased, liver disease amongst all people. And much like in any illness, when it comes to Black people, we tend to, there's that phrase that says, when America catches a cold, Black people get pneumonia. It's that could be that same thing. It was like, when America gets liver disease, Black people get liver cancer. So it's kind of like we tend to get worse in, because with the Black population, there tends to be that the social determinants of health that impact our population, that increases that gap. And so I guess the next question would be, well, what can we do to avoid these things happening besides reducing or cessation of drinking and stopping smoking?
Yeah, so I think, so a couple of things that we've talked about, making sure that you know what your status is related to chronic viral hepatitis is key. Okay. And it's just a simple blood test that the doctors, just to know, do I have hepatitis C? Do I have hepatitis B? If I do, is there evidence that it's damaging my liver? And there's non-invasive tests that the doctors can do, that it's like an ultrasound where they can check your liver and make sure there's no evidence of scar tissue forming. And if we do find that you have any of those things, then of course starting treatment will reduce that risk. Okay. The other thing that people are often amused to hear about is one of the things you can do, for which we have the best epidemiologic evidence, is drink coffee. Oh, wow. So drinking 2 or more cups of coffee a day has been shown in multiple epidemiology studies now in many parts of the world to protect your liver. And so in terms of what's a simple thing you can do that we can tell people, love your liver, drink coffee.
Is there something specific in the coffee?
That's what we think. The challenge, of course, is that, coffee has many things in it. There's
Right.
all these different substances that are in coffee. Some of them are called polyphenols. They're supposed to be good. They appear to be good for you, but particularly there's no question. If you look at the European Association for the Study of the Liver guidelines, they actually put it in the guideline, encourage your patients to drink coffee.
So that's coffee, not those lattes that people go and pay $8 for at Starbucks.
You don't have to pay a lot for it.
We're talking about coffee, which is
right.
No cream, no sugar,
coffee a day.
just coffee. Okay.
Yeah.
We got a question from our audience, and I think this is a good question. It says, "How does diabetes affect the liver?"
Yeah, so that's a great question. And diabetes affects the liver a couple of different ways. One of the things it does is diabetes changes the way that fat and carbohydrates are handled by the body. Mm-hmm. And so that's part of the reason the liver gets this fat deposition in it. It's because of the changes that we get with how fats are handled in the body from diabetes. And that fat that is deposited in the liver then causes this inflammation to start in the liver and causes injury to the liver. The other factor about diabetes also is that diabetes is associated with high levels of insulin in the body. Because, when diabetes, you become what we call insulin resistant. And so what that means is that, your body is trying to drop your blood sugar level by making insulin, but that blood sugar level doesn't drop. So the body pumps up its level of insulin production even more.
Okay.
Insulin has a characteristics where it's cancer inducing. It causes growth of tissues. And so it causes growth of the liver. And that is fine if you're a little kid and your body is growing. But when you're an adult and you have too much insulin, then that stimulates growth of the liver tissue and can predispose you to develop cancer.
Okay. Oh, wow. Yeah, that's interesting. So if the liver is the filter, and one thing I learned, and you can correct me if I'm wrong on this, I also learned, and we were doing a program on cholesterol, and they said that the liver produces all of the cholesterol the body needs. Mm-hmm. Okay. And so does the liver, so that cholesterol that we're eating that externally, whether it's from animal products and other products, does the liver filter that out, or how does the liver work in terms of keeping our cholesterol levels down?
It's a great question. So what happens to everything we eat, of course, is it gets broken down to its basic components in order to be absorbed. So, so all the fats and salt get broken down to very, very basic components and absorbed. And, they get absorbed from the intestines, and then everything gets collected in blood vessels that join to form what we call the portal vein, and that portal vein goes to the liver. So basically, everything you eat that's absorbed by your body goes to the liver, and the liver is sort of your big metabolism processing factory that handles. Okay, so then it says, okay, how much of this do I need to take and try to make into protein products? What that needs to go to fat? How do I handle the sugars? And the liver does all of this metabolism. And so what happens is, if that process is dysregulated, if it becomes abnormal in any way, then you might, for example, instead of the liver keeping down the level of cholesterol that is made, then you may find that the liver is producing more cholesterol than it should. And this ties in also with what's happening in your muscle and what's happening in your fat tissues, as you were hinting earlier. And so those three are all controlled together. And if any one of them goes awry, then it can affect the others also.
Okay, so if we eat too much sugar, that can affect insulin production. If we're eating too much fat, cholesterol production can go up, and that can lead to more cholesterol in the blood system and in the bloodstream, and then that can lead to other issues that are caused by high cholesterol. Okay, so to get it. And proteins as well can have too much protein as well can have some detrimental effect.
Yeah, so generally we don't have problems with too much protein because most of us actually eat less protein than we should. And so generally, the liver will, take what protein what we present, and it's typically broken down into the core components of the amino acids. Those are absorbed, and the liver helps process them, sends some of them onto like muscle to build muscle tissue, and then the liver also uses some of those amino acids to make albumin, which is a very important protein that helps us keep the fluid in our blood vessels.
Okay.
So you mentioned how when you have severe liver disease, your belly gets swollen out, and it's swollen out in part because of the fluid that builds up there. And that's because your liver isn't making enough of the albumin that really allows your blood vessels to hang onto the fluids in the blood vessel. There's not enough albumin, then the fluid tends to leak out into your tissues, and that's what causes that fluid buildup in the abdomen.
Okay. All right. So this is fascinating. Okay. So I guess, here we are. We're talking about the liver, and it's October, right? And so there tends to be this general understanding that October is Breast Cancer Awareness Month. And so shout out to Susan G. Komen for really just making breast cancer awareness, especially Breast Cancer Awareness Month, such a part of the American lexicon, right? Why don't we talk about liver cancer more, and how do we get more people to understand? Because this is very, very fascinating, especially with how important, not saying breasts aren't important, how important the liver is to our daily functioning. Why can't we, what do we need to do to get more people to recognize the importance of the liver and to learn more about liver cancer?
Yeah, it's a great question. And I think part of it, of course, is the liver is hidden away. And so, and it's one of these interesting things. I think part of the reason it's hidden away under your ribs, tucked away in a safe pocket, is because it's so important to the body. that it's sort of tucked away in a very protected spot. But part of the consequence of that is that most people aren't aware that it's there. Right. And one of my friends says it's the Rodney Dangerfield of our organs. It's the one that doesn't get any respect, but it's really doing a lot of good work for us. And so I think part of the issue is really trying to elevate it to people's awareness that you have this organ. It's one of the largest organs in your body. It's doing, lots of work for you, and we just need to show it some love and care. And if we do, then it takes care of us, for a long time, and we don't even know it's there. But it's important to be aware of it so that we can prevent things that will damage it.
Okay, so if you have just been watching us, thank you for watching. If you've been just joining us, this is Dr. Lewis Roberts, and we are talking about liver disease, and specifically today we're talking about liver cancer. And so this is part 2 of our 3-part series that we're doing in partnership with the American Liver Foundation. So thank you for that. So if you want to get more information, the website for the Liver Foundation is scrolling across the bottom of the screen, and it is also in the comment section. So you can click there and get more information. Because we want to make the liver as popular as breast cancer awareness. So we've got to make sure to get that popularity up. So I think, in summary, what we're going to be doing here now is really trying to get people, because a lot of times we get all this information, right? And we say, what do I do with all this information? So Dr. Roberts, what do I do with all this information? When I go for my, go for your regular checkups and physicals to get know you're on, and B, what should I be doing in my day-to-day life in order to protect my liver? Are there some foods? Should I just be eating more plant-based diets? Are there some things that I should be eating or doing in my day-to-day life to make sure that my liver is healthy as intact and intact?
Absolutely, and I think you've mentioned a number of these. I think we've talked about the key word inflammation. So the things that will reduce inflammation in our liver are making sure that if we have viral hepatitis, if it is, we treat it, that reduces inflammation. That if we happen to have diabetes or hypertension or obesity, that we work on the exercise, the improved diet. We talk a lot about the Mediterranean diet, and it's very much plant-based, as you mentioned. Also, most of the protein is through fish, and we know fish is a very healthy food, and so again, prepared so that you don't have lots of fat in it, but prepared with its natural fats. And then the natural fats of fish, the omega-3 fatty acids, those are really great for the body. So all of that, having a really healthy diet, getting our fruits and vegetables, those all are great protection for our livers. And then avoiding things that might be toxic, like alcohol, smoking, that can potentially exacerbate the damage to the liver as well.
Yeah. Okay. So Samuel, there was a question. So Samuel, hopefully that response answer your question. I saw your question come in and I said, well, Dr. Roberts is going to answer this right now. So weight loss, is absolutely important. So if you are overweight or obese being a diagnosis, not what you are, it's another diagnosis. Like if you got diabetes, you have obesity. So weight loss will help significantly in terms of all of your systems, reducing, getting more natural sugars instead of those refined sugars, like high fructose corn syrup. I like how bad those things are in terms of our gut health. So reducing those things. There are some foods that have a natural anti-inflammatory qualities. Dr. Roberts just mentioned some things. Fish is very, very good with omega-3s, and that also helps with your cholesterol. Turmeric, I know, is really good in terms of it's anti-inflammatory. So you could just do a quick Google search and find foods that you could add to your diet that have that anti-inflammatory qualities, and just reduce your alcohol and stop smoking. Those things, and then there's carcinogens that get. I know we like to grill and cook out, right? But if you char that food and ingest that char, there is some cancerous causing qualities in that char that's on the food. And sometimes we like it because it tastes good. We got barbecue sauce, all that stuff. But when that food gets charred, those things are carcinogenic. Am I right about that? I think
absolutely, yes. And so that's again, it goes back to the everything in moderation. It's not that you completely have to avoid it, but you minimize it so that you for the most part preserve and protect.
So this is two things. One, we've got a great program that we just started here on blackdoctor.org. Comes on every Tuesday night, 8:00. It's called Veganish, right? And so that program is designed to help you learn ways to include more plants into your diet, more fruits and vegetables. And I think the term she used was called flexitarian, where it's like you're not completely off of. You're not completely vegan, because that's a whole different terminology. But this is really about only eating lean meats, fish, reducing those fatty foods, and increasing, fruits, plant-based diet. So increasing that portion. And so those things, and a plant-based diet helps a myriad of conditions, not just liver disease. So what I've learned, Dr. Roberts, here is the big 5 are exercise, big 4, I think, exercise, eat more fruits and vegetables, more plant-based diet, get real quality sleep, because that's when your liver really kicks into work, is when you're sleeping. And if you're not sleeping enough, or if you're not getting that deep sleep at night, that can impact how your liver functions. And then finally, reduce your stress, because all that stress can be kind of an accelerant on all of these other things that you have in your life. And so eating well, getting good rest, reducing stress, and exercise will go a long way into keeping not only your liver healthy, but all of your organs in your body healthy. Does that sound like a good formula, a good prescription?
It is.
For someone's life. All right. So we've asked some really, we've answered really great questions. We have some great questions coming from the audience. I do think, before we let you go here, Doug, I think let me give you that last push in terms of really kind of talking about what happens if we do the opposite. We don't take care of ourselves. We don't take care of our livers. What are the severe implications that can happen? We know liver cancer, but if that's developed, what can happen to the body if liver cancer? We know death is an option, but that pathway, so people can kind of get an understanding of what can happen.
Yeah, I think the biggest challenge really is as the liver develops the cirrhosis that we talked about, the scar tissue forms in the liver, you get cirrhosis. Then the blood that's normally coming through the liver to be cleaned up and then passed on to the heart so they can be distributed to the rest of the body, that blood can't get through the liver because of the scar tissue in the liver. So you get what we call portal hypertension. Most of the time when we think of hypertension, we think of systemic hypertension in the main blood vessels throughout the body. The portal hypertension is what forms in the abdomen, in blood vessels that are bringing blood from the intestines to the liver. And so then that high pressure causes the blood's trying to figure out a way to get back to the heart, that's not through the liver. And there's some small blood vessels normally in the esophagus, your food pipe that you eat through to get to the stomach. And those blood vessels can expand. And when they expand beyond a certain stage, they can burst. And you actually get bleeding into the esophagus, into the stomach. And then people start throwing up blood.
Oh, wow.
Something that we call esophageal varices. They get like varicose veins in the esophagus that burst. And then you can also get, because the liver, normally we talked about how it processes your toxins. Mm-hmm. So if the liver isn't functioning well, then you can no longer clean out those toxins. They get through the liver, they go to your brain, and they make you confused, drowsy. You can even fall into a coma from that. Okay. We talked also about the ascites, or the fluid that builds up in your belly because the liver isn't making enough of the protein, albumin, that helps to keep the blood in your blood vessels. And so then you get fluid leaking out. So all of those things, are signs of the end stages of liver disease. And yet, if you develop a liver cancer on top of it, then it just sort of worsens all of that. Because when the liver cancer goes in, and whatever good liver you have, it starts replacing it with cancer tissue. So then it just accelerates the progression of the disease.
Okay. So wow. Thank you for that. I know that wasn't on the question, but I was like, I really want to kind of give people some understanding in terms of impress upon the level of importance that the liver has in our body. And if you don't have a high functioning liver that can filter out those toxins and give cleaner blood to your heart and deliver to your other parts of your body, those toxins get delivered to areas that you don't want them delivered to. Heart, brain, in your esophagus. I didn't know that. I didn't know there was a different type of hypertension. What was that called? Portal
hypertension.
Oh, wow. So that's some great information. So I'm really, really glad I asked that question. So people can kind of really get an understanding of really, A, the importance of the liver, and B, what can really happen on the way to not just liver cancer. Liver disease is really, impactful. So Dr. Roberts, I want to thank you for joining us today. You have been, and thank you for stepping up. When my my internet service went down, you just kept going. It was like that's what I needed from you. You didn't get confused. Like, okay, I'm going to keep going. He'll be back.
Yeah, I was counting on you.
So thank you for holding that down. Thank you for providing such wonderful wonderful information. And thank everybody for joining us in the comment section and for watching. We're going to re-air this tomorrow morning. So tag a friend, let them know we're going to re-air this tomorrow to get this information out. Thanks again to the Liver Foundation of American Liver Foundation. As you can see the website there scrolling across the bottom. Get more information. We want to make liver health just as important as breast cancer, prostate cancer, all of these other things that we know more about. Liver health is just as important, even though it's just tucked away underneath our ribs and lungs. So again, thank you, Dr. Roberts, and we will see y'all. And next week, we've got one more program in part 3 of our liver health series with the American Liver Foundation. So thank you all so much, and we'll see you next time.
Thank you. It's been great talking to you.